It is common sight these days within the West African sub-region and Nigeria inclusive that periodically we hear all sorts of developments from the health sector, either disease or epidemic, call it, some deadly, some not so deadly. The latest scare is the monkeypox. We had the Ebola scare. The federal government tried its best within time. We surmounted it. Chickenpox came. Smallpox came, although the latest has been chickenpox. The very one that is staring us on the face and all is being done to surmount is the monkeypox. By primary knowledge, monkeypox is a rare viral zoonotic disease that occurs primarily in remote parts of Central and West Africa near tropical rainforest with symptoms similar to smallpox. On a daily basis, we hear it has come up from this state. The latest, as we count, is Kano State, a suspected case. Though specimens have been taken for laboratory tests, it will be confirmed whether it is truly monkeypox or not. That will be what we'll be sustaining on the discussion segment of Insights today. Monkeypox care in Nigeria. How far, how well? What should Nigerians be doing at this time? Is it possible that if Nigerians are properly educated on what they should be doing, the scare will not be as much as it should be? Like I said earlier, some are so deadly, like Ebola. We surmounted it. We hear monkeypox is not as deadly as Ebola. We have to sustain this. Dr. Mahmoud Dalhat, he is an infectious disease physician, field epidemiologist, fellow of the West African College of Physicians, and a Secretary General, Nigeria Infectious Disease Society. Thanks for joining me on Insight.
Thanks for having me.
Okay. Also, to sustain the discussion, I have Dr. Godswill Okara. Dr. Godswill Okara is an immunologist and clinical chemist. He is also chairman, West African Postgraduate College of Medical Laboratory Sciences. Thanks for joining me.
My pleasure.
Okay.
Thank you.
Monkeypox. It looks so scary when you hear it and when you see the pictures. Why is it so scary? Let's start with you.
Well, usually, all of a sudden, you see your face, your body, your skin completely taking over. Even though it may not be that fatal in its presentation, the fact that the thing has disfigured you psychologically and mentally, you are under a lot of stress and torture. That is part of the scare, actually, because when you see the clinical presentation and the symptoms, even though the patient may not be under severe threat, the fact that you've been disfigured by the pox and the presentation, it's enough to worry.
Okay. Now, so far, so good. A lot is being done to ensure that the spread is nipped in the bud. What should Nigerians be doing at this time, now that it is, will I say raging? Is it raging?
No, I won't like you to use that word.
Okay, it's a hard word to use.
It's not raging.
Okay.
I would rather use the word it's been confirmed in more states. Initially, it was confirmed in Bayelsa. Now we have 3 additional states, including the FCT, where this virus was being confirmed among suspected cases. All the other states for which we have suspected cases, I wouldn't like anybody to say monkeypox has spread to those states until we get laboratory confirmation in those states. So, it's important to note that public health authorities are doing all they can to understand what is going on and control this outbreak. I want to refer to your earlier definition of monkeypox. There are important keywords there. Say it's a zoonotic disease, meaning it's transferred from animal to human, primarily an animal disease that could be transferred to humans. You mentioned rare. It's rare. So it's rare globally. The whole public health world is trying to understand monkeypox because it comes periodically in the regions you mentioned. So when I say we are trying to understand and address this issue, it's not because there is no evidence of how or what to do. And the Nigerian public health authorities, specifically Nigerian Center for Disease Control, have deployed teams to Bayelsa and the other confirmed other states where this outbreak was confirmed. And we are doing using global best practices based on existing evidence to ensure that all the cases are identified, to ensure that there is no further transmission between these cases to other members of the community, to ensure we give them the required psychological and clinical support so that they run through the course of 4 to 6 weeks after which this disease is supposed to heal. It's a self-limiting disease largely. You tend to get mortality in 1 to 9%, but essentially 1%.
When you say self-limiting, how do you mean?
When you say self-limiting, for instance, if you look at common cold, when someone develops common cold, he may take some medication or he may not take medication. Regardless of whether the person takes medication or not, the body's immune system will develop immunity, protect the person, and they recover completely, whether or not you do anything. Okay. So in the same way, monkeypox is a self-limiting disease in immunocompetent normal individuals. It's supposed to run its course.
So it's not as scary as people sound with it.
It's not as scary as people took it, but the fact that you say it's a rare disease, when people say Ebola, people are struggling to understand what it means. So in the same way, people are struggling to understand what does monkeypox mean. Okay,
before I get to Dr. Godswill, when last did we have it in West Africa and indeed Nigeria? Could you remember?
I think the most recent outbreak was in Zaire, which is the Democratic Republic of Congo now. I think around 1996. Okay. And that is when we have the largest number of patients with monkeypox, and that outbreak was fully investigated. And it is information from such outbreak that the global health world is using now to address the current outbreak.
Okay. So, well, we won't go into what causes it. We'll still get to that. But let me ask Dr. Godswill Okara, what should Nigerians be doing so that maybe we are properly conscientized? Maybe, because I remember during the Ebola scare, a medical doctor, for that matter, was on a walk, and along the walk, he had cardiac arrest. And while he was battling, people ran away from him, thinking it's Ebola, given the fact that Ebola was all over the place. So that there could be some kind of self-help among us. What should Nigerians as a people be doing to maybe kind of ward off further spread as people?
Yes, in the immediate, there is need for public enlightenment. On the long term, there is need to develop laboratory capacity to be able to effectively diagnose the ailment without having to refer samples outside Nigeria. In terms of personnel, Nigeria is blessed. In fact, the coming on stream of the field epidemiology network, it's a laudable development and objective in Nigeria. Going forward, since Nigeria knows some of these epidemic-prone diseases, incidentally, this is not the first time monkeypox is recorded in Nigeria. So there is need to have a database of these epidemic-prone diseases and then develop laboratory capacity to be able to respond rapidly and diagnose the ailment, definitively say this is what we are contending with. That way, control measures will be put in place to arrest outbreaks when they do occur. and then having a database and a trend analysis would also enable the country put public health measures in place to be able to prevent these outbreaks. The records available show that there was cowpox disease outbreak in Nigeria in 1977. It has happened, this is about the third time. So if we are doing thorough public health trend analysis and capacity building, we wouldn't need to wait until we refer sample to WHO reference laboratory in Dakar before we say this is what we are contending with. You are aware that while Nigeria was able to rise to the occasion and nip the Ebola outbreak in the bud was because there were laboratories around in Lagos that could definitively diagnose and say this is what we are contending with. Okay. That way, government was able to respond massively. The Federal Ministry of Health took a very bold step to put control measures in place, and we were able to contend with it. And that shows us that Nigeria can do it. And more so, during the smallpox eradication measures, Nigeria was one of the centers that produced millions of doses of smallpox vaccine and exported to West African countries on the request of World Health Organization. And we were able to eradicate smallpox. The same way, since the same vaccine that can prevent smallpox can also prevent monkeypox, if we are doing what we are supposed to do, we can do a lot better in terms of prevention, in terms of rapid response, in terms of control measures, and all this care.
That's the reason I ask you the question. Beyond what the health authorities might be doing, like professionals also like you, what should Nigerians as a people, because take it or leave it, it's all about the people too. If government is doing so much and there's no reciprocity from the side of the people, this may not be appreciated as much. What should we be doing as a people now? You are talking about awareness. So if you're talking to Nigerians now, what will you tell them to be doing? Yes. For instance, I'm a layman. I don't have an idea of what the symptoms of monkeypox looks like. What will you be telling them?
Yes, the thing is, civil society organizations, professional organizations, this is where they come handy. They should rise to the occasion, come out with enlightenment campaigns, jingles in electronic media, write-ups in print media, to massively educate the public, to know the control measures, the preventive measures they need to take at the layman's level in order to prevent spread.
Okay. For emphasis sake, I know it's in the public domain, the symptoms of monkeypox. Yeah. But just for emphasis sake, how will I know that, oh, my friend next to me, or I as a person, what I have around me suggests symptoms of monkeypox, and what should I do?
Okay. So simply put, a case of monkeypox will usually develop fever, followed after a week to 10 days by rashes. And these rashes are classical, meaning when you see them, the trained eye can describe them and identify them as likely to be that of monkeypox, even though it has close similarity with other rashes caused by other diseases. For instance, chickenpox, smallpox, unfortunately.
And I heard about cowpox too.
Cowpox, okay. Smallpox, unfortunately, few doctors have ever had an experience of seeing a case of smallpox. Okay. So the symptoms to look out for, as I mentioned, fever, rash, which is usually generalized, mostly affecting the hands, the face, and the foot. They could be generalized, especially in immunocompromised individuals. So the advice is we have many other infections ongoing that present with fever and all the other symptoms of weakness, malaria, including the common cold I mentioned earlier. Now, the advice is whenever someone develops an illness, they should go to a facility with competent health practitioners that will be able to assess and decide whether they have monkeypox or whatever disease. It's not just monkeypox. And the second responsibility we have as individuals is to take the advice of the professionals. If you are diagnosed to possibly have it, cooperate with public health authorities, provide your samples, take all the provisional measures they advise, whether they advise you should stay at home or you should come into the hospital, whatever instruction you are given regarding protecting your family members and the rest of the community, you should abide by it, pending when the result of the investigation will come out. It's important to note that a lot of the cases being presented and being listed as suspected cases are other diseases that looks like monkeypox. Okay. So that is why the Emergency Operations Center in the Nigerian Center for Disease Control have to sieve out most of these cases, look at the pictures, the symptoms, the sign, and decide whether these reported cases should be listed in our list of suspected cases or not.
So they're actually not monkeypox after all, maybe from the results that have come up?
No. Majority of them are not monkeypox, but there is an ongoing outbreak which has been confirmed in a number of states, and we're collecting information to really describe whether it is an outbreak that started in Bayelsa and spread to other places, or because of the case in Bayelsa, the surveillance system is sensitized now, and we're picking cases that were ongoing in those states. So it's too early to preempt the public health authorities, but we are working round the clock to ensure that we investigate this outbreak fully and advise the public, put control measures, and also provide guidance to the whole world to learn from this outbreak in Nigeria how best to manage an outbreak of smallpox, just as we did during the Ebola outbreak.
Okay.
Yes.
Now, follow up, sir. What should we do? For instance, now, he has talked about when you see the symptoms. I live in a difficult-to-reach area, and a neighbor of mine has it. And there's no ready vehicle, no road. We need a canoe to get across. What should we do?
Well, usually, in every situation, there's always a way out. Like he pointed out, the need to go to a health facility where we have trained and competent professionals to give advice can never be overemphasized. We are aware that across the country you have comprehensive health centers, you have primary health care centers, you have general hospitals. There will definitely be a way to access a health facility where trained professionals will be able to advise, rather than resorting to self-medication or insinuating that this is an attack by juju people, or that our ancestors have visited us with a strange disease. Such superstitious approach and response will rather worsen situations.
Okay. It's already in the public domain that within the public health sector, government is trying its best to see how this could be nipped in the bud. But we still need to sustain one thing. Are there plans? I'm also happy that the two of you, you're from your profile, you are within this sector clearly. Are there plans to either, because before now, when medicine has not gone this sophisticated, we had these things, and maybe we had our traditional way of handling them. Are there plans to fuse the two, the trado medicine and orthodox medicine? Can the two work?
Well, certainly.
Because right now, if you go into on social media, you have all sorts of medical practitioners there who are coming up with solutions, what to look out for monkeypox, what not to look out for, what to take the orthodox way, what not to take the non-orthodox way. That's what I'm looking at. What is there a meeting point?
Certainly. The greatest problem we face in this part of the world is that our traditional medicine practitioners didn't do well to document the use of herbs and roots and what have you that our ancestors were using to treat ailments in their time. Before the advent of the colonial masters, we had our traditional medical practice that was to a large extent effective in contending with a number of disease conditions. But unfortunately, over time, the practitioners will die with their knowledge. There wouldn't be any calculated attempt to document and pass on such practices. And because of that, there are gaps here and there.
Okay.
In other climes, there was concerted effort to document and codify those practices to a point that now WHO has recognized traditional medicine in a number of parts of the world. Even in some countries, they have up to university degree training in their traditional medical practice.
Okay.
That if you go to health facilities in places like Asian countries, you will see practitioners of their traditional medicine side by side with orthodox medical practitioners. So the choice is yours, who you go to. So, and often they also use the ethno-medical preparations side by side with orthodox medical preparations, orthodox drugs,
yeah,
and they work effectively. So we have good. I think the Federal Ministry of Health has taken a bold initiative in this area to encourage the development of our traditional medicine. They've even created a division in the Federal Ministry of Health to ensure that enabling environment is provided to study and develop our traditional medical practice.
Okay, so in this case now, because during Ebola, we had all sorts too, and there even came a time where there was this scare, people woke up at 2 a.m., had salt bath and what have you. So do we have such, outside maybe the vaccine, is there any trado approach to it?
Well,
Because this could help for those, like I use the word, difficult to reach areas.
Yes,
Maybe if it happens, they could use that as a first aid before proceeding for orthodox medicine.
in life generally, the principle is when in doubt, don't act. For us as scientists, we dwell on empiricism. We dwell on hard facts. Science is all about, they say, the method you performed, the observation you made, the inference you draw from the observation, and the conclusion you draw from your inference. These are things that you can see with your eyes, things that you can verify. Science is all about proof. Whereas religion, we say, when you believe, thou shalt see the glory of God. Science says, if I see, I believe. Science says, show me, and I believe. Seeing is believing. So in the modern world, where science and technology has made life quite easy, it will not be advisable to start resorting to things that are unproven, things that are on at the realm of speculation. Like it happened during Ebola, they will say take cola nut, take bitter cola, take bath in salt water. Those are unproven approaches, okay, which can turn around to be more detrimental than helpful.
Okay, that links me to, let me get back to Dr. Mahmood. During Ebola is also zoonotic, right?
Yes.
Okay, beautiful. Now we are on monkeypox. They said don't eat bushmeat. Somewhere on social media I read and they said don't eat monkey meat. So are there prohibited meals we should not eat during this time?
So
Does this stop anybody from, as they call it, monkeypox? So, but for instance, I go to a restaurant and I'm served bushmeat that says monkey meat. I shouldn't eat it?
So it's important to note that even though it is called monkeypox, it is named because it was first identified from monkeys imported to the United States. So, and that is why it is called monkeypox. So important to know that it also exists in other primates like squirrels and rats in the areas you described, West and Central Africa. So much as we know that there is evidence that close interaction between animals and human beings, and as you mentioned, especially hunting and preparing these animals is an important risk factor for acquiring this disease. From a public health point of view, what you need to do is to look at the human behavior and provide an approach for it. Make people understand that this is how it is transmitted. What can they do to protect themselves when they are prepared? When they are preferably, they should avoid close interaction with these animals, and in situations where they have to do it, they should be careful and exercise caution, because as mentioned, it is transmitted via close contact with animals that are harboring these viruses, or by contact with their fluids, their body fluids. So it's important to give that public health advice that if you are working in an abattoir and you deal with animals, regardless of what type of animals, exercise precaution, use gloves when you are interacting with these animals, because there's a potential for transmission of diseases, not just monkeypox. There are a host of other diseases that are zoonotic that could be transmitted between animals and humans, and this close interaction is an important interface where that could happen, and people should exercise caution. Do you eat bushmeat? The risk is more on the person that is catching and preparing the animal.
Okay, than the person eating it.
Than the person eating it. So when it is properly cooked, most of the organisms that are known to cause disease are destroyed, and there is no evidence that well-cooked bushmeat could transmit these diseases. But there is clear evidence that close interaction with these animals, could lead to transmission of these diseases to humans.
Okay.
So I think the message here is we try to pass the correct information to the public. People should understand what is this disease, how is it transmitted, how can they protect themselves, and also importantly, the fact that it is self-limiting, and the fact that you don't need any treatment for it to resolve. So when you are sick, go to a health facility and so that you get the right treatment. You may go to traditional medical practitioners. They may try all sorts of herbs, but there is what we call the placebo effect. When a disease is self-limiting, you give a drug, the person feels it's this drug that is curing him. Meanwhile, regardless of whether a drug was given or not, this disease is going to be cured. So I think what is important is that issues around access to care should be addressed so that people will have access to healthcare, functional healthcare facilities where they report whenever they are sick, where these things are monitored, as you rightly mentioned, where evidence, hard facts are used to manage patients. I think it's the message that we should pass to all Nigerians.
Okay. I hope and believe eventually Nigeria will surmount this. If we did it during Ebola, there's some confidence that we'll do it now. So for the future, What do you project?
Yes, we have what the Nigerian government calls National Medical Laboratory Services Policy. There is need to fully implement that policy so that in every section of the country, call it geopolitical zone, call it state, we will have capacity to be able to dictate these disease-causing agents. And of course, on the long run, there is need for us to develop the vaccine production laboratory in Nigeria. If we can produce animal vaccines in Nigeria, and we have produced human vaccines in the past, why wouldn't we be able to do it? Why is it that anytime there is any outbreak, we will have to wait weeks and months on end for samples to be carried to a reference laboratory outside Nigeria before confirmation? The Center for Disease Control in the US, in fact, gives assistance to WHO. In the same way, with the kind of endowment Nigeria has, both human and otherwise, we can give assistance to other less privileged countries. It's a question of our government rising to the occasion. If the will is there, we will be able to do it.
What about the private sector?
The private
Do they have a
sector,
role to play here?
the private sector has a role to play, no doubt. Because you see, if you produce vaccine and your country prefers to import ready-made vaccines from outside Nigeria and nobody patronizes you, you will fold up, evidently. So this is what we are saying. If you say we want to produce it in Nigeria, the country has to provide the enabling environment. There are some of our colleagues who worked in the vaccine production lab, Yaba, who over the years, during our association meetings and conferences, they've been talking about their desire to set up vaccine production companies in Nigeria. If you go to India, all the companies that produce vaccines in India, they are private outfits, to a point that WHO now commissions those companies to produce vaccine for use in other parts of the world. So if we were producing yellow fever vaccine in country, but all of a sudden our government actors prefer to import yellow fever vaccine and kill the initiative for in-country production. So this is what we're talking about. Okay. On the long run, there is need for government to address these issues, not only to wait when there is outbreak. You have all sorts of fire brigade and episodic reactions. It wouldn't help us on the long run. Okay. Now it is monkeypox. When we get over it, we relax and we keep waiting until another outbreak comes and we start fire brigade approach. It doesn't help us as a country. Okay,
let's speak to the safeguards now. Safeguards both ways: private sector, government, the people as we coast home. He has spoke to the need for proactiveness.
Yes.
So now safeguards now.
So recently, the World Health Organization supported Nigeria to conduct what we call a joint external evaluation of the country's capacity to prevent, detect, and respond to outbreaks. And the findings was presented. The minister admitted that even though we have done so much in some areas, there are a lot of areas where we need to do better. And the country is going to develop a national action plan to address that, so that some years down the line, when we repeat this evaluation, we'll see where we are. A lot of the issues Dr. Okpara addressed were evaluated there, and there are scores. And we hope that the National Action Plan is supposed to address that. So it's important to note that it's difficult to compare Nigerian CDC with the CDC in Atlanta, but because the Nigerian Center for Disease Control is in its infancy stage, the bill is in the National Assembly, is yet to be passed, So I will also use this opportunity to encourage our lawmakers to facilitate the passage of this bill so that we have an agency that has the capacity to address these issues. Then beyond that, governments at all levels should understand their responsibility regarding prevention, detection, and response to outbreaks, and strengthen the systems to address this. Finally, along those lines, with all sense of humility, I have to say Nigeria stands out among its peers in the African sub-region, in the sense that even after controlling Ebola, we deployed this capacity to other countries that were ravaged by Ebola, and that support of capacity, technical capacity, helped these countries to respond to outbreak. At present, we are helping this country to even train epidemiologists in our training institution. Now, to the public, I think when the house is on fire, nobody say it's you that started the fire. You left that gadget on. You quench the fire before you see how to prevent it. Okay. So I think all hands must be on deck. The public, the private sector should all put their hands on deck to address the issue we have now and support the country to be a better place to prevent, detect, and respond to outbreaks in the future.
Thank you so much. Just maybe in one sentence, speak to possible stigmatization, just in a sentence. It may happen.
Yes, usually. When you see somebody ravaged by rashes, the tendency is to be afraid to associate or interact with the person. When we were traveling to Owerri on Saturday, one of the airline staff wanted to search passengers. Somebody screamed at him, "You don't have gloves with monkeypox all over the place. You want to search me with bare hands." So that kind of thing. There is that tendency of stigmatization, no doubt about that. But with the enlightenment that this disease is not as dangerous and as infectious as people think, it doesn't kill as people think, it's self-limiting. There is this thing we call gamma interferon, which the liver is equipped to produce. And when there is a challenge, the liver will keep increasing its production, and it knocks off viruses. And monkeypox virus is one of those that the gamma interferon produced by the human liver is able to knock off.
Thank you so much.
There is no need for people to be afraid of those who have been exposed to it or try to stigmatize them.
All right, thank you so much. Bottom line, monkeypox is not as deadly as the scare went.
Certainly.
I've been chatting with Dr. Godswill Okara, immunologist and clinical chemist, chairman, steering board, West African Postgraduate College of Medical Laboratory Science. It was nice having your thought with us.
Thank you very much.
And also Dr. Mahmoud Dalhat, infectious disease physician, field epidemiologist, fellow of the West African College of Physicians, and Secretary General, Nigerian Infectious